Tuberculosis is a serious illness that mainly affects the lungs. The germs that cause tuberculosis are a types of bacteria. Tuberculosis can spread when a person with the illness coughs, sneezes, or sings. This can put tiny drops with the germs into the air. Another person can then breathe in the droplets and the germs enter the lungs. Tuberculosis spread easily where people gather in a crowd or where people live in a crowded condition. People with HIV/AIDS and other people with weakened immune system have a higher risk of catching tuberculosis than people with typical immune system. Drugs called antibiotics can treat tuberculosis, but some form of the bacteria no longer respond well to treatment. Symptoms of tuberculosis. When tuberculosis germs survive and multiply in the lungs, it is called a TB infection. A TB infection may be in one of the three stages. Symptoms are different in each stages. Number first, primary tuberculosis infection. The first stage is called the primary infection. Immune system cell find and capture the germs. The immune system may completely destroy the germs, but some captured germs may still survive and multiply. Most people don't have symptoms during a primary infection. Some people may get flu-like symptoms such as low fever, tiredness, and cough. Stage number 2, latent tuberculosis infection. Primary infection is usually followed by the stage called latent tuberculosis infection. Immune system cell build and wall around lungs tissue with tuberculosis germs. The germs can't do any more harm if the immune system keep them under control, but the germs survive. There are no symptoms during latent tuberculosis infection. Stage number 3, active tuberculosis. Active tuberculosis disease happens when the immune system cannot control an infection. Germs cause disease throughout the lungs or other parts of the body. Active tuberculosis may happen right after primary infection, but it usually happens after months or years of latent tuberculosis infection. Symptoms of tuberculosis disease in the lungs usually begin gradually and worse over a few weeks. They may include cough, coughing of blood or mucus, chest pain, pain with breathing or coughing, fever, chills, night sweat, weight loss, not wanting to eat, not feeling well in general. Active tuberculosis disease outside the lungs. TB infection can spread from the lungs to other parts of the body. This is called extrapulmonary tuberculosis. Symptoms vary depend on what part of the body is infected. Common symptoms may include fever, chills, night sweat, weight loss, not wanting to eat, pain near the site of infection. Active tuberculosis disease in the voice box is outside the lungs, but it has symptoms more likely disease in the lungs. Common site of active tuberculosis disease outside the lungs include kidney, liver, fluid surrounding the brain and spinal cord, heart muscle, genital area, lymph node, bone and joint, and skin. The wall of the blood vessel, voice box, also called a larynx, may include. Symptoms are similar as teenager and adult. Now, causes of tuberculosis. The tuberculosis is caused by bacterium or bacteria called Mycobacterium tuberculosis. What is drug resistant tuberculosis? Some form of the TB bacteria have become drug resistant. This means that drug that once cured the disease no longer work. Now, risk factor for tuberculosis. Anyone can get tuberculosis, but certain factors increase the risk of getting an infection. Other factors increase the risk of infection becoming active tuberculosis disease. The Center for Disease Control and Prevention recommended a TB test for people who have an increased risk of TB infection or active tuberculosis disease. Risk of tuberculosis. Living with someone with active tuberculosis. Living or traveling in a country where TB is common, including several countries in Latin America, Africa, Asia, and specific Iceland. Living or working in a place where people live close together, such as prison, nursing homes, and shelter for homeless people living in a community identified as being at high risk of tuberculosis, working in a healthcare and treating people with a high risk of tuberculosis. Other health related conditions will become a risk factor for tuberculosis include HIV/AIDS, diabetes, severe kidney disease, cancer of the head, neck and blood, malnutrition or low body weight, cancer treatments such as chemotherapy, drug to prevent rejection of transplanted organ, long-term use of prescription steroid, use of unlawful injected drugs, misuse of alcohol, smoking, and using other tobacco products. Preventing the spread of disease. If you have active tuberculosis disease, you will need to take steps to prevent other people from getting an infection. You will take drug for 4, 6 or 9 months. Take all the drug as directed during the entire time. During the first 2 to 3 weeks, you will be able to fast TB bacteria to protect other with these following steps. Stay home, don't go to work or school, isolate at home yourself, ventilate the room, wear face mask, cover your mouth while sneezing. Vaccination. In countries where tuberculosis is a common, infants often are vaccinated with a bacillus called made-grown vaccine. This protects infants and toddlers who are more likely to have active tuberculosis disease in a fluid surrounding the brain and spinal cord. The vaccine may not protect against disease in the lungs, which is more likely in the United States. Dozens of new tuberculosis vaccine in various stages of development and testing.